This is the equipment that's required to do your blood sugar, and we have a couple of things you're going to need to gather each time. You're going to need a bottle or some kind of alcohol wipe, a cotton ball or a sponge, either one, they work equally well. We have a glucometer. This one happens to be the Lifestyle Light, but any of them work equally well. We have a bottle of test strips. There's the test strip sitting out for our test. And then it's a lancet holder, and this is the lancet. So there again, you have isopropyl alcohol, a sponge for the alcohol, your glucometer, lancets, and glucose test strips. The first thing you want to do is you want to get your test strips out. You want to be sure and check the back of the test strip. Check the back of the test strip and check that date. This happens to be 2013, which is good. On some glucometers, you have to check the code, and you have to match this code with the back of the glucometer. This particular type, you don't have to do that, but you need to know each hospital that you might work, it's a little bit different, so you need to check that out to make sure that you understand which one that you do need to check the code and which one you don't have to. This particular type, you don't. And this is what the test strip looks like. The test strip has two small dots at the bottom. These small dots are actually where the blood's going to be. Up here is the darker black area. That's the part that goes into the machine. And you can always look at the butterfly. The butterfly goes in with the antenna up, the antenna towards the machine. The next step that you want to do is you want to put the lancet together. You don't want to put the test strip in the glucometer yet because there's a timing mechanism that starts as soon as it is engaged. So what you want to do is you take the lancet holder, a couple things you need to know about it. You can dial the depth. Here's the number. This one's set on number 2. You can dial the depth here. Say you have a patient that has really thick skin. You can make that the spring load go in deeper. You're going to remove this cover. The lancet actually fits right here in this hole. It only goes in one way. This little round part goes in the bottom. The long shaft fits down inside the hole. And there's a little click as it engages. Then what you want to do is you want to remove this. So I always just hold it and twist and pull it out. And now your lancet is in the holder and ready to use. Always be sure to snap the cover back on. You're going to hold this part next to the patient's finger pretty firmly, and then this is the button that releases the spring load. And you pull back on this to set the spring. So now your lancet's ready. Next step, patient's finger. Use some alcohol to wipe it off. You're going to take the lancet, press it firmly against the finger, hit the spring load, give it a little bit of a squeeze, and then you put the blood right on that little dot. And that's all it takes. And there's the patient's blood sugar, 101.